we are going to learn about it in detail. When we talk about pericardium, what do you mean? Peri means around. Around what? Around the heart. Okay, basically that is the meaning of pericardium. We know that the heart is present in the middle mediastinum with its pericardium. Okay, if you see this pericardium, it is a fibroserous sac. Fibroserous sac. So it is showing two components, one which is fibrous, other one that is serous. Okay, and this serous in turn is showing two more divisions, that is the outer layer is the parietal and the inner one is the visceral. So here we have got the visceral or the inner layer of the serous component of the pericardium. So one, we have got the fibrous layer, okay, and second we have got the serous layer. The serous layer in turn has got two layers, that is the parietal and visceral layer. How one we came to, we will learn now. Okay, if you see, this is the fibrous pericardium and here we have got the serous pericardium. Okay, so what I have drawn here, this is the fibrous pericardium and this is the serous pericardium. Now, during development, if this is the heart, okay, this is the primordium of the heart, okay, that embryonic stage we are just trying to draw. The heart, while it is developing, it is invaginating into this serous sac, as a result of which, please see, here if you see the heart, okay, we are having this invaginating into the serous, this is the serous, the visceral layer, this is the visceral layer, out of the serous sac, it is the visceral layer. Yeah, please listen once again. So we have the visceral layer. So when the heart is invaginating into the visceral layer of serous pericardium, the innermost layer is reflected out like this. You are understanding? So here we have got the visceral layer and the layer which is reflected, that becomes the parietal layer. And this parietal layer is in close association or it is stuck to the inner surface of the fibrous pericardium. So here you are having the pericardial cavity. So what do you have between the two layers of the serous, between the two layers, that is the parietal and visceral layer of the serous pericardium, you are having the pericardial cavity. Are you able to follow? The invagination of the heart, so the one layer, that is the visceral layer which is present, is reflected, okay, at the roots of the great vessels in such a style where you are now having two layers. One is the inner visceral layer, outer parietal layer. Both of these, they come under the serous portion of the fibrous, the serous portion of the pericardium. Both the visceral and parietal layers, they are the components of the serous layer of the pericardium. The fibrous is the outermost portion of the pericardium. So here you have seen the outermost yellow in color I have drawn, that is the fibrous pericardium. Okay, and between the two layers, that is the parietal and visceral layer, we are having the pericardial cavity. Now, we are going to learn about the fibrous pericardium in detail. If you see this fibrous pericardium, okay, now just let me run. So if you see this fibrous pericardium, the fibrous pericardium name itself is saying it is fibrous, means it is tough. So it is enclosing the heart and also the great vessels. It is enclosing the heart and also the great vessels. Okay. The fibrous pericardium, it is so tough, it is so strong that it prevents the over distension of the heart. It also prevents the sudden overfilling of the heart. The sudden overfilling of the heart is prevented because of the toughness of this fibrous pericardium. Okay, now if you see the fibrous pericardium, we are trying to draw, this is the diaphragm. The central tendon of the diaphragm, you can take this portion as the central tendon of diaphragm. And if you see, the fibrous pericardium has its base which is very broad, and this broad base is merging inseparably with the central tendon of diaphragm. That's why I use the same color. Okay, the base of the fibrous pericardium had merged, okay, with the central tendon of the diaphragm inseparably. You can't separate just like that the fibrous pericardium. It is merging with the central tendon of diaphragm because it develops from septum transversum. The fibrous pericardium is developing from septum transversum. So that is the reason you are not able to separate. Okay, then that is separate the base of the fibrous pericardium. And here if you see, we are trying to draw the left ventricle. Okay, now this is the ventricle we have drawn. You know the wall of the ventricle, it is showing, it is muscular, the left ventricular wall. Okay, and here we have got the aorta which is coming out, the ascending aorta. Okay, so the fibrous pericardium is enclosing not only the heart but also the roots of great vessels. So where is the apex of the fibrous pericardium? It is corresponding to the sternal angle. We learned about sternal angle, right? In great detail. So the sternal angle, at the region of sternal angle, we are seeing the apex of the fibrous pericardium extending up to the region of the sternal angle, enclosing the roots of the great vessels. And this fibrous pericardium, if you see, the inner surface of the fibrous pericardium, is very much in contact with the parietal pericardium. In white I am drawing, that is parietal pericardium or parietal layer of serous pericardium, you can tell. The parietal layer of serous pericardium, and here inner you have got, this is the visceral pericardium. The visceral pericardium is the innermost layer of the serous pericardium, and this is the visceral pericardium, which is also called as epicardium. Are you following what I am trying to talk? So we are having what? The fibrous pericardium, where the base is blended with the central tendon of the diaphragm because its development is from the septum transversum. They are inseparably blended. That is the base of the fibrous pericardium and the central tendon of the diaphragm. Coming to the apex, it is ending at the level of the sternal angle, the apex of the fibrous pericardium. It is enclosing not only the heart but also the roots of the great vessels. Now anteriorly what is present to the fibrous pericardium and posteriorly what is present. So for that we have to turn lateral. We are trying to draw the diagram of the mediastinum. Okay, now you know the diagram. So it's something like this. Yeah, this is what? The manubrium of the sternum. This is the body of the sternum. This is the xiphoid process. You are seeing lateral view. Okay, laterally you are seeing the sternum. Starting from this sternal angle to an imaginary line that is drawn towards the vertebral column, here it is the lower border of T4. Here you are having T3, then T2, right? You remember this diagram? So this is superior mediastinum, this is inferior mediastinum, and here we have got the diaphragm. Now here in the inferior mediastinum, what you are having? You are having the pericardium. Okay, just let me draw this fibrous pericardium, and here we have got the heart. Okay, the pericardium. Are you able to understand? Here you have got the middle mediastinum. This is anterior mediastinum. This is posterior mediastinum. Are you understanding? This is the inferior mediastinum, whole of it. The presence of the heart with its pericardium in the mediastinum, the presence of heart and the fibrous pericardium in the middle mediastinum is dividing the inferior mediastinum into anterior posterior, and this portion is the middle mediastinum. The pericardium, the heart with its pericardium, please listen, the heart with its pericardium present in the inferior mediastinum divides the inferior mediastinum into anterior mediastinum and posterior mediastinum, where the heart and its pericardium is present is the middle mediastinum. So if you want to know the relations of the fibrous pericardium, anteriorly what is present, we have got the sternopericardial ligaments. One is superior, other one is the inferior sternopericardial ligaments. Superior and inferior, these are weak ligaments. They are attached to the posterior surface of the body of the sternum. And what is present posteriorly? Posteriorly we have got the principal bronchi. Now here is the trachea. We have got the principal bronchi of the right lung and the left lung, and then we have got the esophagus. We have got the esophagus which is present, okay, and are you able to follow? We have got the esophagus and then we have got the principal bronchi. Also, if you see on either side of the fibrous pericardium, on either side, you are having the mediastinal pleura, the mediastinal surface of the lungs, the phrenic nerves. What do you have? The mediastinal pleura, the mediastinal surface of the lungs, and the phrenic nerves you are having on either side of the fibrous pericardium. So coming to the blood supply of the fibrous pericardium. The fibrous pericardium is supplied by the musculophrenic artery, branches of the descending thoracic aorta, okay, they are supplying this fibrous pericardium. The internal thoracic artery is also supplying the fibrous pericardium. So what are they? Internal thoracic artery, musculophrenic artery, and the branches from descending aorta, the branches from the descending thoracic aorta, the branches from descending thoracic aorta, they are all supplying the fibrous pericardium. And what is the nerve supply? Obviously the phrenic nerves. Now what is the importance of this? The phrenic nerve is supplying this fibrous pericardium, as the result of which it is pain sensitive. The fibrous pericardium, though it is tough and fibrous, it is pain sensitive because it is supplied by the phrenic nerve. And to the inner surface, please understand, if this is the fibrous pericardium, the inner surface is the parietal layer of serous pericardium, okay. So the outer surface what you are seeing is the fibrous pericardium, and when you look at its inner surface, when you touch the inner surface of the fibrous pericardium, it is very smooth. In the dissection hall, please touch and see, it is very smooth. Why is it smooth? Because it is layered, it is coated by the parietal layer of serous pericardium. That is the reason why this is smooth, the inner surface of the fibrous pericardium, because it is lined by the parietal layer of serous pericardium. Let's quickly revise about the fibrous pericardium. The fibrous pericardium is the outermost layer of the pericardium. As the name suggests, it is fibrous, tough and rough. This fibrous pericardium, it prevents the overfilling of the heart. The sudden overfilling of the heart is prevented by this fibrous pericardium. Also, the distension is prevented by this pericardium. The fibrous pericardium, it has got an apex, it has got a base. So if you see the base of the fibrous pericardium, it is broad. It is blended with the central tendon of the diaphragm, because the fibrous pericardium is developing from septum transversum. You cannot separate the base of the fibrous pericardium from the central tendon of the diaphragm. If you see the apex of the fibrous pericardium, the apex of the fibrous pericardium is present at the level of sternal angle. It is enclosing the roots of great vessels. And the relations of the fibrous pericardium anteriorly, posteriorly, on either side, let us discuss. Anteriorly, if you see, the fibrous pericardium is connected to the posterior surface of the body of the sternum via the superior, this is the superior inferior sternopericardial ligaments. So we are having superior and inferior sternopericardial ligaments which are connecting the fibrous pericardium to the body of the sternum. Coming to the posterior relations of the fibrous pericardium, posteriorly there are the principal bronchi and the esophagus which is present. Okay, posterior relations are the principal bronchi and the esophagus. And if you see the structures which are present on either side of the fibrous pericardium, they are the mediastinal pleura, mediastinal surface of the lungs, and we have got the phrenic nerves. So these are all the structures that are present on either side of the fibrous pericardium. Now the blood supply of the fibrous pericardium, it is vascular. It is supplied by internal thoracic artery, internal thoracic artery, musculophrenic artery, and some branches from the descending thoracic aorta. Coming to the nerve supply of the fibrous pericardium, it is the phrenic nerves which supply this. Because it is having the phrenic nerve supplying it, it is sensitive to pain. It is sensitive to pain. And coming to the inner surface of the fibrous pericardium, if you see the outer surface, the pericardium is rough. Outer surface of the fibrous pericardium is rough. But if you see the inner surface, it is smooth because the parietal layer of the serous pericardium is fused to it or is seen merging with it. The parietal layer, it is seen fusing with it. What? The parietal layer of serous pericardium. Okay? Thank you. This is in continuation with the pericardium. We have learned yesterday that is the fibroserous sac. Okay, the pericardium is, and we said the serous layer is in turn made up of the parietal, okay, that is the outer layer, and the visceral, which is the inner layer, right? We have discussed in great detail about the fibrous pericardium yesterday, and I used yellow color, right? So we have used the yellow color for the fibrous pericardium. Now we will learn about the serous pericardium in detail. If you see the serous pericardium, it is a thin double-layered sac. So double layered is one is outer, one is inner. Outer is the parietal layer which is fused with the fibrous pericardium. We have learned the pericardium. If you see, this is the pericardium, the outer layer. If you turn it and see, the inner layer is smooth because of the attachment with the parietal layer of serous pericardium. This we know. Okay. Also, we have learned that if you see the heart, when we have drawn the primordium of the heart, we said there is the fibrous pericardium. So this is the fibrous pericardium, and here we are having the visceral pericardium. The visceral pericardium, and it is reflected in such a style. Okay, now here you are having, this is the parietal pericardium. What is seen in close association with the fibrous pericardium, this is the parietal layer which is in close association or fused with the fibrous pericardium. We are having the parietal layer, and here we have got the visceral layer. This visceral layer or inner layer of serous pericardium is also called as epicardium. So short note, what is epicardium? Which layer of the pericardium is called epicardium? So they will tell the fibrous layer, the parietal layer, the visceral layer, or whole of it. So you know the inner visceral layer of serous pericardium is called as the epicardium. Why? Epi means what? Above. So if you see the heart, just above the heart you are having this epicardium. It is very much in close proximity with the entire heart except at the grooves. You have atrioventricular grooves between the atrium and the ventricles, interventricular grooves where you have got blood vessels. In the grooves, the interatrial groove, the interventricular grooves or the atrioventricular grooves, along the grooves of the heart, you know there are blood vessels. So epicardium which is present on the heart almost fused to the heart. It is not dipping into the grooves because the grooves are already occupied by the blood vessels. So it is running over the grooves, except at the grooves, remaining entire portion of the heart, the the visceral layer of the serous pericardium is attached. That's why it is called as epicardium. When you are trying to separate or pull out the epicardium on the surface of the heart, excepting the grooves on the surface of that, when you are trying to pull out the epicardium, then you are damaging the heart. So be careful. Okay? Then if you see the space that is present between the two layers, the parietal and the visceral layer, here you are getting space. I have just zoomed it. You think I made it large? Actually, like that it won't be there. It's a very potential space, very thin, between these two fingers. How much space is present? Hairline, like that. Very thin space is present. Only for you to understand, I have made it large. Okay. So this is called pericardial cavity. This pericardial cavity is filled with some fluid which is acting like a lubricant to the opposed surfaces so that heart can beat normally. For the efficient functioning of the heart, there is some fluid which is present in the pericardial cavity. So what is pericardial cavity? Please tell. The space or the cavity that is present between the parietal and visceral layers of serous pericardium is called pericardial cavity. Now why I am talking so much? There is a clinical condition called cardiac tamponade. What is that condition? It is called cardiac tamponade. Okay, or it is also called pericardial effusion. So here we are calling it pericardial effusion. Now what is this pericardial effusion? It is a clinical condition in which more amount of fluid is accumulated in this pericardial cavity. If more amount of fluid is accumulated in this pericardial cavity, that time what is happening? When the ventricle is relaxing. What do you mean by ventricle is relaxing? Diastole. The blood from the left atrium should be poured into the ventricles, right? And this during the systole. What is systole? Contraction of the ventricle. The blood is pumped out, and that's what you call a cardiac output. When the filling of the ventricle itself is less because of the compression of the heart by this pericardial effusion, obviously the cardiac output will be less. So what is happening? The patient is not having enough blood circulated in his body. You're understanding? So this decreased cardiac output is because of inefficient functioning of the heart. Why inefficient? Because the fluid that is present in the pericardial cavity is compressing the heart. It's not allowing it to go with the complete diastole. So the filling of the ventricle is impaired, as a result of which the cardiac output is also impaired. Now what you will do when a patient had come to you with cardiac tamponade? You take a needle, direct it upwards, backwards and lateral. Upwards, backwards and lateral along the left, fifth or sixth intercostal space, just lateral to the sternum. Are you understanding something? You are going to take a needle, direct it upwards, backwards and to the left, just at the lateral border of the sternum, at the level of left, fifth or sixth intercostal space. Now how do you count the left fifth or left sixth intercostal space? Anteriorly we count the ribs from the sternal angle. We have already learned about the sternal angle. So at the sternal angle is corresponding to the level of second rib. Below that will be third rib, fourth rib, fifth rib. Now between the fifth or sixth ribs on the left side, just at the lateral margin of the sternum, you will prick with the needle and you will aspirate the fluid. Then the patient will have some relief. Serous pericardium. Let us quickly revise. Now the serous pericardium is a part of the pericardium, which is basically a fibrous serous sac. The serous pericardium in turn has two layers, outer parietal and inner visceral layer. Between these outer parietal and inner visceral layers there can be accumulation of fluid because there is a cavity present that is called the pericardial cavity. So if somebody is asking where is the pericardial cavity present, between what layers, then you can boldly tell them it is between the outer parietal and inner visceral layers of the serous pericardium. We are having pericardial cavity. The inner visceral layer, here if you can see, is in close approximation with the heart, and that is why it is also called as epicardium. That means just above the heart it is present. It is almost fused with the heart, you can take. Except at the cardiac grooves, where there are grooves on the surface of the heart, like the interventricular groove or the atrioventricular grooves. In the grooves you have got the arteries. The epicardium is just present over the surface of the heart. It doesn't dip into the grooves because the grooves are already occupied by the blood vessels of the heart. And when you are trying to prick the epicardium, it is not possible to pick the epicardium without damaging the musculature of the heart. Okay, that is the close proximity of the visceral pericardium with the heart. That's why it is also called as the epicardium. I have not told in the explanation, but now in the revision I am telling the epicardium is supplied by autonomic nerves. There are autonomic nerves which are supplying the epicardium, as a result of which the epicardium is not pain sensitive. The epicardium is not pain sensitive. Are you understanding the fun? It is in close relation with the heart and it is not having pain. That is the fun. You are understanding? The epicardium is in close association with the heart but is pain insensitive because it is supplied by the autonomic nerves. But if you talk about the parietal pericardium, the parietal pericardium is definitely pain sensitive and in condition called pericarditis, that is inflammation of the pericardium. What do you call it as pericarditis? In this condition called pericarditis, yes, pain is felt and it is beginning from or it is arising from the parietal layer of serous pericardium. Are you understanding? The epicardium is pain insensitive because it is supplied by the autonomic nerves. But if you take the parietal layer of serous pericardium, it is very much pain sensitive, and in conditions of pericarditis, that is inflammation of the pericardium, the pain is originating from the parietal pericardium. Okay? Now, there is some fluid that is present in the pericardial cavity, very little quantity, in order to lubricate the opposed surfaces for the better functioning of the heart. Enabling the better functioning of the heart, there is some fluid that is present. The function of it is to act as a lubricant. But sometimes there is increase in this pericardial fluid to such an extent it starts compressing the heart. This clinical condition is called as cardiac tamponade, or it is also called as pericardial effusion. Cardiac tamponade or pericardial effusion. Now what is that causing? It is not allowing the ventricles to relax fully and get the filling up from the atria. Entire blood is not reaching the ventricle. Okay, because the ventricles are not able to relax fully during the diastole. Because there is because the blood that is reaching the ventricle is less, the output when the ventricle contracts, the cardiac output will also be less. Are you understanding? So that time what you will do? You will take a needle and aspirate the fluid out. So that needle should be directed upwards, backwards and lateral. Upwards, backwards and lateral. You will first count from the sternal angle, second, third, fourth, fifth ribs. Okay? Between the fifth or sixth intercostal spaces on the left side, just lateral to the sternum. Again I repeat, lateral to the sternum, just along the lateral, just by the side of the lateral border of the sternum. In the left fifth or sixth intercostal space, you will direct the tip of the needle upwards, backwards and lateral and aspirate the fluid that is present in the pericardial cavity. And then the person will have some relief. Thank you. Thanks for listening.